Hello and welcome back to GP Video Podcast by Nadia. Today, the topic that I'm going to open, because I'm going to make a few video podcasts on this topic, that is menopause. Menopause is the topic that is very commonly encountered by the female GPs in the GP world. And this is a topic that we really need a lot of awareness about. And what is the treatment, what are the symptoms, what can we do about it, and a lot about it. So I am going to be very thorough about this topic, and I think you guys should persevere with me. And then if there are any questions, you can ask me that as well through the messages or through the comment section if I'm not able to, because I'm not able to read messages all the time. So we can go through the comment section and I can answer the questions over there. So let's start. What is menopause? Basically, menopause is just one day. Yes. So the myth is, okay, menopause is a period, menopause is this, menopause is a phase. No, menopause is just one day. It is the last day of your very last menstrual period. Just happens on one day, done and dusted. Okay, so that is the definition of menopause. Now, what we really talk about is perimenopause. Perimenopause is the period in which we experience all the symptoms. Okay, so before we touch on to perimenopause, I would like to tell you the average age of menopause in Australian women is 51 years. Normal range is between 45 to 55. So if anybody gets a menopause, the one day that I'm talking about, the last day of your last menstrual period, if the age is between 45 to 55, that's considered normal. But we will talk about if it happens before 45, what do we call it? That's, as I said, it's a very vast topic. So now we have understood that menopause is just one day, which is the last day of your last menstrual period. Average age is 51, and the age group, normal age group, is between 45 years and 55 years. Now, perimenopause is the time period that we talk about when we experience all the symptoms, when we have all the difficulties, and when we go through all the stuff that we do not find very pleasant. So perimenopause is the time period leading up to menopause. So it's the time period before menopause leading up to the menopause. So it starts anytime before menopause when you start experiencing the symptoms. So what are the symptoms? Change in bleeding pattern, more or less frequent. So you can have more bleeding, you can have less bleeding, you can have more frequency, you can have maybe 2 to 3 cycles a month, you can have let's say in 3 months you can have 1 cycle, so less bleeding or more bleeding. Change in bleeding pattern, again, lighter or heavier. What happens is, because in this perimenopause period, which is the period leading up to menopause, basically the hormones are all up and down. So you can experience the symptoms related to increased estrogen or decreased estrogen. So you can have more bleeding, you can have less bleeding, you can have breast tenderness, you can have let's say headaches which are caused by more estrogen. So you can experience anything in that period. So we said that the perimenopause is the time period preceding the menopause. Then till when does it last? Does it end when on the last day of last menstrual period, which is the menopause day? No. Perimenopausal period lasts up to the 1 year after the menopause. So it starts before the menopause, which can be a few years before menopause when you start experiencing the symptoms. And then you can go up to the 1 year mark, and then perimenopause finishes, and then after that the period is called postmenopausal. Okay, so perimenopause is any time before menopause, maybe a couple of years, maybe just a few months leading up to menopause, which is the last day of your last menstrual period, and extends up to 1 year exactly after the last day of last menstrual period, and that is called perimenopausal period. After completing 1 year of menopause, then we call that period as postmenopause. So I think now we are clear about what is menopause, which is just one day, what is perimenopause, which is the most important period when we experience all the symptoms, and then number 3 is what is postmenopause. Okay, all right. So What is perimenopause characterized by? It's characterized by all the symptoms it can have, because there are estrogen and progesterone receptors all over our body, including brain, including muscle, including bones, including GIT. We can have any sort of symptoms because the hormones are fluctuating in those periods, up and down, so we can experience any kind of symptoms. So it is also characterized, as I said, by hormonal fluctuation and ovulatory cycles, so the cycles in which woman is not ovulating, and onset of cycle irregularity and menopausal symptoms. So one can have 3 cycles in a month, or let's say no cycle in 3 months and just 1 in 3 months. So it could be anything. And as I said, postmenopause is after 1 year of menopause. Now, some women can be like on contraceptive medications, can have an IUD, Mirena IUD. So bleeding or change in bleeding might not what we will see always, because if they have got the external hormones going in there by the pills or by the IUDs, then their cycles are going to be very regular. So maybe change in bleeding pattern is not what we will see regularly. But if they are on nothing, then, and if like no contraception, then we will see the changes. So we can have breast symptoms, as I said, because there could be periods when there is more estrogen. You can have breast tenderness. You can have mood symptoms, as I said, that the brain has receptors as well. So anxiety, depression, palpitations, then hot flushes and night sweats are vasomotor symptoms. Like these are the symptoms which are produced by the dilatation of the blood vessels, because blood vessels also have the receptors, and hot flushes, which are the vasomotor symptoms, can be really annoying. So really a GP has to really think hard while a patient comes in front of you and then describes all these symptoms, which could be even few years before menopause. So you have to really think hard that whether this depression and anxiety is actual depression and anxiety, or is it related to menopause. Palpitations are because of a real cardiac cause, or is it because of menopause, and everything else we have to think really hard. I'll come back to this topic tomorrow because it's so many things, and I'm most importantly interested in telling you all about the hormonal and non-hormonal treatment of menopause. How do we take it? How do we classify it? Who, when, where, what? We'll tell you all about it. See you soon.